My name is Joanne Du. I'm going to introduce the paper published in iMeta. The title is "The Salivary Microbiota is Altered in Cervical Dysplasia Patients and Influenced by Colonization." WHO launched a global strategy to eliminate cervical cancer. Known risk factors for cervical cancer including HPV infection, HIV infection, smoking, and increased parity. The current vaccines don't cover all oncogenic HPV types, and other groups found HPV types not covered in the current vaccine had increased during past decades. Emerging evidence supports that vaginal microbiota is associated with HPV infection and dysplasia. Poor oral hygiene and tooth loss are associated with an increased risk of oral cancer. Several oral pathogens, including fusobacterium, are also related to different cancers. Numerous studies have shown that smoking is also a risk factor for developing cancers, including cervical cancer. However, data related to oral or salivary microbiota and cervical dysplasia are still limited. Our group collected saliva samples from 67 participants, including 20 healthy women, as well as participants came for diagnosis due to potential dysplasia or participants treated with conization upon diagnosis of dysplasia. We subgrouped them into with and without cervical dysplasia group and pre and post dysplasia group. DNA were extracted from all 67 saliva samples and tested for 27 different HPV subtypes. The V3-V4 regions of 16S RNA genes has been sequenced using Illumina sequencing platform. We found significantly decreased microbial community richness and diversity, as well as significant dissimilarities in participants with and without dysplasia compared with the control group. Similar trends were observed in participants from the pre- and post-dysplasia groups compared with the control group. We also demonstrated the relative abundance of Haemophilus and Alloprevotella were significantly increased among the saliva samples from the vaginal examination participants than the healthy controls. The pathways of primary immune deficiency, viral carcinogenesis, protein glycans in cancer, and RIG1 receptor signal pathways were also significantly changed. Based on the similarities in the general, we found 3 different salivary microbial types. Participants in the groups with and without dysplasia had higher percentage of type 2 and 3 than the participants in the control group. A similar trend was observed when comparing pre- and post-dysplasia groups compared with the control group. We showed microbiota beta diversity between the pre- and post-dysplasia participants was significantly altered. Actinomyces was significantly increased in the dysplasia group. Actinomyces was also found to be associated with increased RIG1-like receptor signal, which is elevated in patients with dysplasia. In the end, we compared the smokers and non-smokers and found the smokers had significantly altered salivary microbiota beta diversity when compared with the participants who never smoked. Actinomyces was once again significantly increased among smokers compared with the non-smokers. Combining cytology HPV infection with the oral actinomyces abundance, the diagnostic ability has reached to 0.945. In summary, we found the salivary microbiota is altered in cervical dysplasia patients compared with a healthy individual. We found 3 salivary microbiota types, and also we found salivary microbiota is influenced by colonization and smoking. Thank you.